Hi there, Dr. Tansavatdi here. So today I'd like to address one common question that I get from my surgical patients, and that is, what can I eat after a facelift or my rhinoplasty or my eyelid surgery? Particularly for facelift and my rhinoplasty patients, I recommend a soft diet, and so some options for a soft diet that still help you to recover is key. And so patients that have talked to me usually will say, oh, I've been eating a lot of carbohydrates, or I will be eating cereal or some oatmeal or some other foods that have high amounts of carbohydrates. And I will tell you that that is not recommended, only because it can slow down your healing. Carbohydrates are known to have a spike in your glucose, which will then release something that's known as insulin growth factor, and that is an inflammatory component that can have an effect on how you heal. Not saying that carbohydrates are not good, it's just you would want to minimize how much you take in during your recovery process. So what should you eat then for after the surgery? There are some recommendations I have, and I'm going to break it down into what's good for breakfast, snack, lunch, and dinner. So I want to make it as simple as possible. So what you want to think about are foods that are high in protein and actually fat, and less in carbohydrates. Good carbohydrates would be those that have high fiber, so there's a slower release of the carbohydrates. That would be your vegetables. So a mix of vegetables that maybe you've boiled and they're soft, or a mix with, so that's going to be the vegetables for the carbohydrates. Lentils would be a good source of protein, as well as beans. And then we can also talk about adding fats through either a method of getting that from your meats, or you can add additional fat through cream, milk. So whole fat milk is a good option. If you're lactose intolerant, then another option would be your medium chain triglycerides through coconut milk or coconut oil. That's another good option. So these are all options that you have, particularly if you have a restriction in your diet and you want to use something that still has high protein and have high fat content for the recovery process. So what would a typical meal for one whole day look like? So options that you have for breakfast would include an omelet that has vegetables that have already been cooked and mashed into there, combined with cream or whole milk, or your medium chain triglycerides, or coconut milk. Those are options to blend the eggs to make the omelet. Another option is scrambled eggs. And then one thing that you can combine with the scrambled eggs is taking meatballs that you have now cut up into smaller pieces and that you can chew very easily. So that would be another option for breakfast. The last option, less protein and more carbohydrates, so not as good, but still can be a good option, would be oatmeal. That you want to make sure that you are adding some other things to the oatmeal. So my recommendation would be adding milk or cream with brown sugar, and then adding some fruits as antioxidants. Options would be raspberries and blueberries. Another option for the morning breakfast is a rice porridge. This is very common in an Asian type of atmosphere for breakfast, and so that is something you can combine with minced meat, cutting up the chicken or other meats and making sure that it's well shredded before you put it in the rice porridge. All right, now let's move on to a snack. What can you have for a snack that might be an option for you? Smoothies are great options, as well as protein shakes. Now, when you get the protein shakes, there's two options that you'll find at your grocery store or even online. That might be a milk-based powder that's a protein shake. You want to minimize some of that if you do have lactose intolerance. Some people do get acne breakouts from that. So if you want another option, a vegan option is going down the route of a vegetable-based protein powder, and most of those are made from pea protein, so that could be a good source for you. Now you can combine the protein powder with milk or with almond milk as another option, or coconut milk, as I said earlier, and combine that with almond butter as a good source of protein and fat with your antioxidants, raspberries and blueberries. That's a great shake. I've done it myself and it's very tasty. So good options for you there for your snack. Another good option for a snack would be a yogurt. Yogurts are smaller usually when they come in the store. You can have the whole milk variety, that's a Greek yogurt option, and that has a good source of protein in it. You can also go down the route of a fully Greek yogurt with less fat if you want. And then you can also combine with ramen is a great small meal that you can have as a snack. Combine that with Jell-O or applesauce. These are other sources. Now, applesauce and Jell-Os have a little more sugar than I would like you to have, but you can find the non-sugar type Jell-Os that are out there. What else can you have as a good snack? A pudding. That is puddings that are very similar with the yogurt, very soft and able to be easily taken in. So now we will move on to lunch. So good options for lunch, and again, whatever I say for lunch can be used for dinner as well. So what would that be? A good option would be spaghetti. Spaghetti sauce on a regular pasta. Now the spaghetti, you want to make sure the meat is well minced in there. You can use beef or chicken, and either is a good option. Another option for lunch would be using fish fillets. That could be your cod or salmon. Now with salmon, there is higher source of omega-3 fish oils, and so that could be a source of easy bleeding. But in the first 2 to 3 days, you might want to eliminate fish for the first few days, but then after that it's okay, as long as, of course, there's no source of bleeding, there's no concern for a hematoma, then yes, you can go ahead and start putting fish into your diet. And when you take the fish, you cook it, and then you want to go ahead and mash it. An easy way to cook fish without putting too much sauces on it, I like to use lemon juice mixed with garlic, parsley, or cilantro, and a little salt and pepper. Easy, very easy to do, doesn't take a lot of dressing, and it's really healthy for you. So that's my recommendation for lunch. For dinner now, or in between lunch and dinner, you can add another snack as well, a small snack. When we get to dinner, you can have things that are maybe a little bit heavier, like the mashed potatoes with gravy. You can also mix meatloaf. I'm not a big meatloaf fan myself, but I know some patients who do love meatloaf. And then for some patients who like, now this is more on the Asian side, there's stuff like liver, kidney, other organs, pork blood. Those are softer, and those can be mixed and minced in with your food if you so happen to want to do that for a source of protein. But what are other sources of good protein? That would be your lentils and beans. So you can make it into a soup so that it's softer. You could also cook the lentils and combine it into another dish if you so choose, or combine it with your mashed vegetables. Cooked soft vegetables are a good addition to the rest of your meal. And then I also recommend, if you do want to have a little bit of carbohydrates, just that taste, is to add rice as a good source, with minimizing it to less than a pack of carbs. So that's that is one serving, so less than a pack of carbs, the size of a pack of carbs. That would be the amount of rice that you would add. All right, so there you have it. I hope this was very helpful. We do have a list of foods that we recommend, and that is in a separate document. If you haven't received it from us, you can go onto our website too for resources, and that's on www.facesbydrt.com. You can check out some more of our videos on our YouTube video page at Faces by DRT1 and Instagram at Faces by DRT. Thank you for tuning in.